Hi, everyone. Good evening, and thank you for joining us. I'm going to make a slow and staggered start while we wait for the others to join us. My name is Dr. Diksha. I'm an educational psychologist and a lecturer in education based in Dubai. And Autism Connect very kindly asked me to come and speak to you today about this very vital, crucial, research-backed, evidence-based area of need, area of difficulty, which has been coming round and about in terms of lots of academic circles, in terms of research background, in terms of clinical circles. Lots and lots of people are talking about autism in girls and women. It's definitely an area of concern. It's an area of need. It's an unidentified, undiagnosed, sort of brushed under the carpet kind of topic, which is slowly starting to come to light. So hopefully today's session will be a little bit of a starter in a way, in terms of just understanding this very complex topic. I'll try and answer your questions to the best of my abilities. Please do pop that on the chat as the live goes on. And I'd be very interested to know whether you are a parent of a child with any needs or just a parent, whether you're an educator, a little bit about your background. Right, I'm just having a look at the time and I will make a start now. We have lots to get through today, so hopefully we can get all of that done in time and leave some time and space for your questions. So as part of my practice, I've been fortunate enough to grow in terms of identification. So what does autism in girls and women look like? I'm not an expert by any means. I've had to learn and grow just as any other clinician who's involved in the diagnostic process has to. So lots of identification, screening, assessment, and support work going on in this field, at least here in the UAE. So this is what our session today will look like. We first have a very deep dive into not what is autism, but why is it so hard? Why are we even having this session? Why is it an area of contention? Why is it underdiagnosed? Why are there so many concerns around it? We'll explore a couple of theories related to the gender bias. So in relation to autism, we'll definitely have a chat about mental health because that is something that we often get to see at the outset. And then also talk about how do we actually support girls and women with autism. We'll have a talk about assessment tools. We'll have a talk about resources. So I've got lots of stuff to share with you today. Right, we'll start off with a staggering statistic, which says that autism is diagnosed in boys 4 times, or men, 4 times more often than in girls or women. There is a lot of speculation about why this is the case. Is it truly that boys or men are more wired to be more autistic, if that's the right phrase to say it? Or is it underdiagnosed in girls? There's lots of conversations happening around this, and we'll uncover some of that today. So very, very, very generally, very basically, autism is a lifelong developmental disability, difficulty, diversity, whatever you want to call it, which primarily affects how people communicate and interact with each other and with the world. And there could be elements of repetitive behaviors or interests in this regard. The most recent research-backed statistics sort of state that 1 in 36 children, so we moved on from 1 in 100 a couple of decades ago to 1 in 36 children have a diagnosis of autism in the USA. Now, these numbers could be very, very depending on which area of the world you come from right now. So we understand that autism is being diagnosed a lot more, being understood, being valued, being supported a lot more now than before. So these are very general statistics. However, out of these 1 in 36, so let's think about if you're an educator, if you're in school, about 1 in your class potentially could be on the spectrum, right? But out of every 4 men or boys diagnosed, only 1 of them are girls. why is this discrepancy in statistics? Okay, is it that autism just affects men? Or is it that girls are not understood? Lots and lots of reasons for this. And I would really like to spend some time exploring this with you today. I think okay, I'm not even going to come at this from a research perspective. Let's look at this from a general layman's perspective, right? If you type autism on Google, autism spectrum disorder, autism spectrum condition, or autism, the definition of autism that you get, the pictures around autism that you see, the videos around autism that you get to view on YouTube, they are all very stereotypical in the sense that they highlight a very gender-biased perspective on autism. Lots of parents that come to me, or lots of clients that come to me, so adult women who come to me, they said, we don't think we're autistic because we don't fit into the typical Google sort of framework of autism that's out there. That is and I'm being very stereotypical as I say this, and I absolutely acknowledge that. That is of a boy who's rocking, someone who's banging their head against the wall, someone who's having a tantrum or a meltdown, someone who can't make eye contact at all, and someone who is stimming, someone who has tics or repetitive behaviors that they cannot control. Now, this is a very stereotypical notion of what autism looks like. Autism does look like this, but on the other hand, someone who presents with autism can be extremely high functioning. They can be verbal, they can have average or above average intelligence, they can do really well in their careers, in their relationships, in terms of their health, in terms of their mental health, but still just have the core issues with social communication and interaction, or some elements of their interests, right? So it's a very, very broad definition. And the definition that primarily exists in society, in movies, in popular media, on TikTok, on Instagram, is a lot around men or boys. Okay, very rarely in popular media will you see conversations or pictures or videos or movies around women with autism. And it's not because it doesn't exist. It's because there's not enough out there about them. Unfortunately, a lot of the screening or assessment tools are quite biased in terms of diagnosing autism in relation to men or boys. So most of the assessment tools, actually all of the assessment tools that we use as psychologists or psychiatrists or anybody who's involved in the diagnostic process, they have to be standardized. They have to be used, tested amongst a group of people, like thousands and thousands of people, right? But with autism-based tools, we now are beginning to understand that these have been standardized mostly on boys or men, or when these tools were created, they were created keeping one specific gender in mind, which is not wrong. That's absolutely fine, but that doesn't bode well for girls and women on the spectrum, because these tools fail to recognize the nuances, the specificity of the other gender. Although this is changing, so that's a good thing. Women actually have a tendency to receive a very late diagnosis of autism. So obviously best practice talks about, so like any other form of diversity, if you think about ADHD or dyslexia or a learning difficulty, whatever it is, we always say that early identification, early screening, early assessment, early support is the best. But what happens when this takes place in late adolescence or adulthood even, right? I've had lots of clients coming into me, women who are 16 years of age, 18 years of age, 30 years of age, 45 years of age, thinking about, okay, somebody told us that we're autistic. Can you help us uncover this a little bit? So by then, you've gone through life thinking, I cannot have relationships, I cannot maintain friendships, I have anger issues, I have anxiety issues. So you're mislabeled as something else, but you don't ever get to the cause. Or those other explanations, they don't explain the whole story. They don't explain you as a whole, right? And that's where somebody or the other, it might be a family member, usually in my experience, in my personal experience, it's often your therapist. So women they think they have mental health difficulties. They end up going to therapists or psychologists or psychiatrists. They might be on medication. But like I said, there's very little progress, very little understanding. And then somebody says, okay, go get tested for autism. And that's when there's a little bit of a wake-up call, right? So they're often misdiagnosed, potentially, or there's an overlap of diagnosis. Unfortunately, I'm not saying all, but a lot of the professionals who are involved in the diagnostic process of autism do not have up-to-date, regular, or research-based understanding of what autism in girls or women looks like, which is really unfortunate, because what that means is, first of all, because teachers and parents and families or society doesn't recognize autism in women, so there's nobody to sort of highlight that from there. But even if you end up going to your general practitioner or to your pediatrician or to your psychologist, even if they don't have an idea of what autism looks like, then well, you're doomed. You don't know where it's coming from, right? And that's why we need to talk more about autism in girls and women across every single layer of society. And I think point number 6 is one of the biggest sort of factors, is that girls or women learn, and we'll talk about this in more detail in the next couple of slides, learn to mask, hide, camouflage, whatever you want to call it, the typical key features of autism, right? So you might see some boys engaging in very stereotypical autistic traits or behaviors, such as meltdowns or tantrums, or not making eye contact, or not being able to have any friends, or not playing with typical games. But girls tend to learn that. They tend to imitate expected behaviors. So they might be autistic, but they learn to kind of fake it. They learn to mask it, mask their natural tendency. And that isn't really fair on them, right? So they go underdiagnosed. Right, let's spend a little bit of time talking about this, a couple of theories that are related to this gender bias, right? Why are boys or men more diagnosed with autism than girls or women? Unfortunately, there is no, like the causes of autism, there's no one singular established cause of autism. There is no established theory which can fully explain this gender bias, but there are some attempts, and we can sort of highlight that a little bit. The first one, which is a very interesting one, which is the extreme male brain theory of autism. Now, as I say this, you will absolutely understand that there are parts of this theory that may not be very relevant, but I still need to put it out there, which just says that within the autism sort of, what's the word that I can use? Within the field of autism, the people who have this condition, they have more of a male brain. And what I mean by male brain is the ability to be systematic, the ability to be organized, the ability to be really structured, the ability to complete jobs and tasks more effectively. So that's a very male-based thinking. Whereas on the other hand, females are more prone to be empathetic, to relate to others, to be more emotional, to be able to connect to others. So typically, traits of autism are more related to the male phenotype in that sense. Now, we know that this isn't true for everybody, but that's the idea. That's the idea behind the extreme male brain theory of autism, which says that we're just looking out for men, and people who have autism are very men-like. Don't know what that means, but that's what the theory says, which has now been debunked. So there's a lot of research saying that this theory, there's not much research to support this theory, but this is still interesting because you can see this out there. You can see this kind of thinking, this philosophy, this understanding in members of society. And also, part of this theory suggests that when children with autism are in their mother's womb, they may be more exposed to, or what puts them at risk for developing autism, is higher levels of exposure to testosterone, to hormones like testosterone or androgen, so stress chemicals, right? Whether that is through internal factors or external factors. Again, there is some research backing to this, but this is not an established fact. It's very interesting to note. Our perspective, our vision, our theory, our philosophy is very male-based. And that sort of comes about in the extreme male brain theory of autism, right? On the other hand, let's switch things around a little bit. There's a female protective effect. What does this say? For females to exhibit the very stereotypical autistic traits, so lack of eye contact, concerns with behavior, repetitive behaviors, repetitive interests, social communication difficulties, they need to have a lot more of these characteristics to be able to be visible to people out there, to be visible to their teachers if they're in school, to be visible to their parents, to be visible to their doctors. So in essence, they really need to be outside of the norm, like significantly outside of the norm, for somebody to notice that, hey, something's up here. Let's see what we can do to help you. They tend to get brushed under the carpet. Right. Okay. A couple of additional factors which sort of drive home the importance of autism in girls and women is that 80% of autistic girls remain undiagnosed at the age of 18. So diagnosis happens after the age of 18, which really, it is helpful. Of course, it's helpful. Or diagnosis, I mean, this is my professional view. And of course, we can have a debate about this, but diagnosis at any age can be helpful. So we're not saying it isn't, but this is quite late as compared to males or boys who have a tendency to get diagnosed quite early on, right? They are more likely to have special interests which culturally blending. So a key aspect of being on the spectrum is having repetitive interests. So for boys, it could mean anything. I mean, a special interest in terms of trains or cars or science or anything like that, right? Which comes across as odd, potentially, because they just want to talk about that. They just want to play with that. They just want to engage in that. But with women or with girls, these become more creative pursuits. These become things like dolls or art or any other creative pursuits, which are considered culturally relevant. So nobody thinks that it's out of the norm. Nobody thinks that, okay, this is literally an obsession with this one particular thing. It's more socially acceptable, right? They're more likely to, like I said, mask or hide their social communication difficulties. They're often seen as shy. They're often seen as shy, unable to make friends, or just an angry person, but that's about it, right? Very important thing, and we'll talk about this later, is they're more likely to have co-occurring, comorbid, or overlapping, whatever you want to call it. Their symptoms, their difficulties are a lot more internal. So if they're thinking about something, if they are doing lots of repetitive things, it could all be in their head. There could be a lot of rumination, overthinking, obsession, but they might not act it out as boys or men tend to act out, which is then picked up by the people around them. It's a lot internal, which makes it harder for us to understand, which makes it harder for us to screen these girls and women, right? And unfortunately, that puts them, this undiagnosed sort of difficulty puts them at increased risk of mental health difficulties of any kind of victimization. So what does masking look like in autism, right? Girls or women might create scripts. They might, making friends or being out in social situations might not be comfortable for them, but they learn how to do it. They might form a script. How do I introduce myself? Like, we don't have to think. Neurotypical people don't often have to think unless they have social anxiety. How to go out and meet someone new? How do I approach someone who looks interesting? How do I share my interests with someone? But a girl or a woman with autism might learn a script. They might learn a formula. They might learn how to do it. They might pick things up from others. They might be very socially perceptive, right? They might say things like, okay, this person introduced themselves like this, so that means that's the right way to do it. So I need to go home and I need to practice and rehearse this, right? So very observant. They might notice or be told things like, look up, make eye contact, do this and do that. Lots of social pressure on them, which they tend to follow, right? I've seen lots of women with autism go online, so a couple of my clients, and then think about, how do I improve my social skills, right? They might practice within themselves. They might take a lot of pressure to improve and then actually end up improving themselves, but still have that intense stress, guilt, pressure, shame around the whole social interaction aspect, right? They might learn things from books or from TV or social media, actively learn, right? They might copy other people. Oh, so this is how you shake hands. This is how firmly you grasp someone's hand. You don't, this is how you don't behave with people. This is how you behave with people, right? So all of this basically hides the autistic traits. In reality, which is nothing to be ashamed of, but because society expects everyone to act and behave in a certain way, that's what they learn, right? And in this process of masking, of hiding, of the immense pressure, what happens is they end up developing mental health difficulties. Imagine, you've gone through your life constantly thinking or being labeled as shy, as unavailable, as rude, as unapproachable, whatever it is, as anxious. There's so much pressure on you that you start to behave in the way that others want you to behave. And when you've been doing that for years and years and years, so decades, imagine if you're 20, if you're 30 years of age and you had all of this pressure, eventually that pressure cooker is going to sort of blow out and result in mental health difficulties, especially at key transition points such as puberty, such as transition to college or university, or when you're transitioning to employment. This is when you get to see the actual negative impact of undiagnosed autism in girls or women. It ends up presenting as mental health difficulties, right? Couple of interesting points for us to consider here. Autistic women typically receive more mental health diagnoses such as bipolar difficulties, autism, or depression prior to diagnosis. So we're not talking about post-diagnosis, we're talking pre-diagnosis, right? It presents itself. So we're just looking at the tip of the iceberg. We're looking at the anxiety or depression or this need to just shut down. But what is underneath that, we haven't explored yet, right? Again, within autistic women, within women who have had a diagnosis of autism, their mental health difficulties are quite significant, so significant that they end up having to be hospitalized because they're so unable at one point to cope with the expectations of society, social expectations of society, right? What does that look like? Identity. Who am I? I have no idea. I've had clients who have said, okay, I've had a diagnosis of ADHD, of anxiety, of bipolar difficulties, and I'm on medication, and I have sensory needs, and I cannot pay attention to anything, and I don't have friends. But none of this explains me. They don't know who they are. They don't have a secure sense of self, right? Identity, uncontrolled mental health needs, sometimes, not saying all the time, medication doesn't prove to be helpful because the medication is more geared towards their mental health. It's about taking the edge off the anxiety or the depression. And that's what happens, right? That's what doctors or professionals or therapists end up seeing. And hopefully if some of them have some understanding of autism, that's when the request for assessment sort of comes about. So the concerns pre-diagnosis usually are a lot more significant. I'm not saying diagnosis changes everything. It's not a one-stop shop. It's not a magic trick, not a rainbow. It's not going to change everything. There are still post-diagnosis concerns for women or girls. There is social acceptance, cultural understanding, the stigma around it. How do you share? How do you share your diagnosis at 20 years of age or 18 years of age or 30 years of age? You've now women at 65 years of age getting a diagnosis of autism. How do you share that with the people around you? How do you start building a new sense of self? Right? So all I'm trying to say here is two things. Number one, if you know, work with, or are aware of anybody with autism, of course, we know that there is a significant overlap, but especially you're a girl or a woman with autism, a female with autism, please be mindful of their mental health and well-being as well. Don't just try to manage their autistic traits. There is cause to be mindful about their mental health, right? Okay. What does diagnosis look like? I'm going to sort of leave this here for you to read and think about. So lots of anecdotes which come about. Diagnosis is rebirth, it's empowerment, it's validation for when nothing else made sense. It's like that aha moment. It leads that person onto a journey of self-understanding, and especially if that comes on later in their life. If diagnosis takes place, if assessment, if support, if these conversations take place at an early age, we can prevent a lot of these difficulties. We can promote identity development. We can promote positive mental health and well-being. But it's only if it happens at that stage, right? Okay, so we're sort of coming towards the end of our session. What do we do, right? We know the concerns. We know a little bit of an idea about how autism is masked in sort of the female sort of gender. What do we do? Where do we start? Okay, if you're thinking of that, then these are conversations worth happening. I think, like I said, the first thing is to create more awareness and understanding of what this looks like for girls and women. And then naturally, as part of that, you move on to early identification and intervention with using the right screeners, the right assessment tools, which we'll have a chat about in the next slide. So like for anybody else, especially for girls and women, it's harder to diagnose them because they mask, they hide their true difficulties. But it's important to do that, right? At the earliest possible stage. We need to have these conversations with educators, with schools, about what they're looking out for. Are they referring the boys in their classroom for assessment or for further support, who are acting out, who are throwing tantrums, who cannot cope externally, who are externalizing their difficulties, which means that you can see it. They're exhibiting observable difficulties, as opposed to the really shy, unable to make friends, really angry little girl in class, right? Obviously, there needs to be more mental. When we are talking about girls and women in autism, we need to concurrently to talk about their mental health as well. It's very hard to separate the two. But also, like with any other neurodiverse condition, the next step after school is, okay, for some people, higher education. For some people, that culminates in employment. How much do employers know and understand, are aware of anything related to neurodiversity? I do see, being in this field for about 9 to 10 years now, there is definitely an increased scope to talk about this, but we need to drive it home, right? This is just the beginning of the journey. Post-diagnosis, I think there needs to be a lot more support from peers, from family, from society around, right? Girls and women may also exhibit some sensory difficulties. So difficulties with loud noises or bright strobe lights, some sensory sensitivity to food, to touch. This could manifest in many, many different ways. But sensory and social support of absolutely crucial in terms of managing this condition. Right. So I'm sharing some useful resources here with you, which I'll talk through with you. Okay, so the first few, you can take a screenshot of this, of course, or look it up. These are screeners. I mean, obviously, with autism, there's no one standard assessment which can say, yes, you're on the spectrum, or no, you're not on the spectrum. It needs to be a holistic assessment. Consultation, observation, assessment, developmental history, all these sort of things going together. But like I said, a lot of the tools that are traditionally used are standardized or are biased towards the male gender. So there is some research to suggest that these tools on your screen, the Autism Spectrum Quotient, the ASSQ, and the newly sort of becoming more popular Girls Questionnaire for ASC, sorry, which is they're more sensitive, or they take into account the more nuances of working with girls and women, actually. So this might be particularly helpful, not from a diagnostic point of view. I'm not going to say that, just from a screening point of view, right? So whether you want to use this for yourself, whether you work in a school and you want to use it for the girls and young women that you work with, whether you're a clinician, whatever your background looks like, these might be of support. And then, okay, so this is more from an assessment point of view. But there is a point after assessment when you've gotten the diagnosis, right? What happens then? That's when the journey actually begins. It's very hard to just get a report and go like, right, I'm on the spectrum, or my child is on the spectrum, my partner is on the spectrum, my friend is on the spectrum, whatever it is. After that starts the journey of self-understanding, of self-realization, of psychoeducation, truly understanding what autism looks like, what does it mean for you, what resonates with you, and how can you make life easy for yourself, right? So the National Autistic Society, that's the first link. This one has a lot of useful resources. Barry Carpenter has written a very useful book, which I usually recommend to the parents of girls who are on the spectrum that I work with. NASN has obviously got some good resources as well. And then, of course, some information on safety skills right there for you. Right. I think this is the last sort of slide that we have. And these are all high-flying women who have gotten diagnosis of autism, late diagnosis of autism. And this is what they say about the whole process, right? I think there's a lack of understanding of how autism can present in girls. I'm expected to behave a certain way to fit in socially, which is why I spend so much time masking. I feel autistic women are more likely to be described as anxious, and an autism diagnosis can be overlooked. There's a difference in how society treats and socializes males and females with autism, right? So this is not just coming from an outsider's perspective, it's also coming from the perspective of women who have been diagnosed with autism. Right. I think, yes, that is the end of our session today. You're more than welcome to obviously ask me any questions right now or later on, and I invite you to follow me on social media or Instagram. I try to do community events here and there, at least once or twice a month. So it would be great to see some of you there. And if you have any questions, of course, I'd be happy to answer them. Right. I think this is a little bit of feedback from someone who's been watching, who said this is a very interesting topic. The underlying challenges need to be addressed in order to provide the correct support. Of course, we often focus on the little boys in the early years and see little girls as shy. Thank you for bringing the conversation forward. Thank you for sort of sticking around and contributing to the conversation. And absolutely, I think if there's one thing that you could take away from this, I mean, obviously you could take away whatever you want, but that is that girls and women learn to hide, mask, camouflage certain features that are very typical of autism. And we need to sort of work around that a little bit to get to the surface of their strengths and needs. I'm going to hang around for a minute or two to see if there are any comments or questions from anybody else in the audience. Right. So I'm going to bring the session to an end. Thank you so much for your participation. Thank you for sticking around. And do sort of share this talk with anybody who might be interested or who might find it valuable. And I look forward to connecting with you sometime soon. All the best and thank you for your time.